Hey guys, my name is Emily Burchett. I am a paramedic, and today I'm going to teach you how to obtain IV access. First, a little about myself. So I'm currently in graduate school at CUSOM, which is Campbell University School of Osteopathic Medicine. I'm obtaining my Master of Science in Biomedical Sciences. I've been a National Registry Medic for the last 3 years, and I've been in EMS for a total of 5. I originally got my BS in biology from NC State, go Pack, and I enjoy running. This picture is actually from my most recent half marathon in Portland, Maine. Beautiful place, I highly recommend it. And then this little black and white guy is my dog, Cisco. He is spoiled rotten, if you couldn't tell. And then my cat is actually in the background, that's Floyd. So some learning objectives. After this, the student should be able to identify the equipment required to obtain IV access. They should know the correct order of steps that they need to go through, and they should be able to obtain an IV access on their own. Step 1. So first thing we want to do is make sure that we have all the proper equipment. That includes gloves, a sharps container, an IV catheter, a start kit if applicable. So some agencies have start kits that they provide, some do not. So if you work for an agency or you're somewhere that doesn't have a start kit, that would be an antiseptic swab, gauze pad, tourniquet, tegaderm, and tape. So even if you don't have a start kit, you can definitely get all of these items. A saline flush and an extension set. Next, you're going to prep your equipment. So that includes tearing all the tape that you need to secure your IV properly. You're going to make sure that your alcohol pad, gauze pad, tegaderm, and tourniquet are close by and ready. So opening the tegaderm, possibly opening the alcohol wipe, making sure that you can get your gauze, that kind of thing. You want to make sure you have clean and proper PPE on, and you want to prep your extension set. So you want to flush your extension set with your saline to make sure that there's no air in the line. Because as soon as you're ready, you want to make sure that that's ready to go. So as soon as you need it, it's prepped. You don't have to worry about hooking it up or flushing it once you've already got a catheter in someone's arm. The next step, you're going to identify a proper site. So if you have a conscious patient, you definitely want to make sure that you ask them if it's okay if you start an IV on that arm or on that side. If they're unconscious, then you use your best judgment. If you can see, like in this picture, the obvious dialysis shunts, that would not be a good arm to start an IV on. So you would want to look at the other one. Mastectomies are a little bit harder to know if the patient is unconscious. So if you're able to ask them, then that's great information. If not, then again, use your best judgment. Next, you're going to apply your tourniquet and palpate. So we want to make sure that we're feeling these veins. These are obvious veins that you can see on most of these examples, and that's great, but that's not everyday patient. That's not the real world. So you really want to make sure that you're feeling these, and you want to get in the habit of palpating for a vein, so feeling for them. Your older patients, like this one down in the bottom right-hand corner, they're not all going to look like that. That bruising, that's pretty standard that you'll see. These are actually nice veins on this hand, but you want to make sure that you're feeling them, especially you want to get used to knowing that they're squishy. So if you feel something that's not squishy, it might be a tendon, it might be something else that you don't want to try to cannulate. Next, you're going to cleanse the area. So once you've identified where you're going to go, you want to cleanse the area. So you're going to start with your alcohol wipe right on the spot that you want to insert your IV catheter into, and then you're going to make a circle outward. So you're going to start from the middle and work outward, and you don't want to backtrack. So once you clean the area, you don't want to clean it again, and you don't want to touch it. If you touch it, that's fine, it happens, especially as you're getting started. You just want to make sure that you clean it again before you actually try to cannulate. Next, you're going to select your catheter and remove it from the package. So if you choose an 18 gauge, a 20 gauge, 14, 22, whatever you choose, you're going to remove it from the package using sterile technique. So you don't want to touch the tip, you don't want to touch the catheter, nothing like that. And you're going to inspect it. So just do a quick look, make sure that it looks like it hasn't been tampered with, make sure it looks like it has a catheter on it, and then you're going to loosen the catheter. So you're just going to give it a little twist right at where the color meets the clear on these. Just a little twist to kind of break that seal a little bit. Next, you're ready to insert your needle. So you're going to stabilize the location. You already know where you want to go. It's clean, it's prepped. You're going to stabilize it. So you're going to pull the skin taut, hold it with your other hand. So if your right hand dominate, you're going to hold it with your left so that you can have the needle in your right hand. And you're going to pull that skin taut. You're going to make sure that your fingers aren't in the way of your needle. And then you're going to inject. You're going to insert the IV needle. You're going to go in at about a 35 to 45 degree angle. Once you're in, you should feel a pop. You're not always going to feel a pop, so it's okay if you don't. But you should always get flash in your chamber. So this dark red blood is what you want. You want flash in your chamber. That shows that you're in a vein, or you've at least hit a vein, and there's blood return. Once you get that dark red flash in your chamber, you're going to decrease your angle, so you're going to go almost level with the skin now, and you're going to continue to insert the whole thing, the IV and the catheter, 1/4 to 1/8 of an inch. So just a little bit. So you've hit it, you're in, you've hit it, you're in, you're gonna insert, you've got flash, you're gonna drop your angle, insert a little bit more, and then we're gonna go to the next step. So you're gonna stabilize it, and you're just gonna move the catheter in. You're gonna stabilize the needle and advance your catheter, okay? Before you pull the needle out, we want to occlude the vein. So you're going to tamponade. You're going to go to where you think the very end of that catheter is, and you're going to hold pressure. Okay, so we've basically just put a catheter in to hold that vein open so that we can give medication, fluids, whatever the case may be. And we want to close it so that we can get the extension set on before blood rushes out of the end of our catheter. So you want to tamponade the vein, and then you're going to remove your needle, get rid of the sharps, and then you're going to attach your extension set. When you attach your extension set, you should be able to draw black and get some blood. That, again, would confirm that you're in a vein and you didn't just nick one and that's why you got flash in your chamber. So if you're able to draw back and you get blood, that's usually a good indication that you're solidly in a vein. While holding on to your IV catheter still, you are going to release your tourniquet, and you're going to flush a little bit of your saline. So when you're doing this, we're doing that to make sure that we haven't infiltrated. So we didn't just nick a vein, that's why we got flash, and now we're not actually injecting fluid into the vein. It's infiltrating, so it's going into the tissue around it. So we're checking for that. We're checking to see, does the patient feel any burning, or is it painful? If the patient answers yes, then we would need to reevaluate, and that wouldn't be a pain IV. If the patient says no, great. If you have no resistance when you're flushing, then that's a good sign. It usually is indicative that you have a patent IV. So you're going to release your tourniquet and flush your line. While you're doing that, again, you're going to check for infiltration. So you see there's that bruising. We don't want that. If you notice that lady's hands, her right hand is much more swollen than her left hand. So that would be an indication of some infiltration, and that would not be a patent IV. We would not want to use it. We would want to remove the IV catheter, apply pressure, and find another location to start an IV. Then we're going to secure the line. So once we know that we haven't infiltrated our patient, that we have a great line, we're going to either put a Tegaderm on it, we're going to use, I call them toilet seats because that's what they look like, another way to secure it, or tape. Okay, if you don't have a Tegaderm, you don't have one of the toilet seats that come in the kits, then use tape, okay? Secure your line down. You've worked hard to get it, you want to make sure that you keep it. So we're going to take a look at some examples. Here is one. Let me pause it and make it bigger. Okay, so we're going to walk through this. So this guy is putting a 14 gauge in. And if we notice, his thumb is underneath his needle. One, that's not sterile technique because it looks almost certain that his thumb is touching that catheter. We don't want that. And he's not pulling the skin taut. Do you notice that? He's not holding the skin with his other hand to help himself out. He's just trying to shove that needle in there. So he continues to try. It's not working out like he wants it to. Continues. He's just pushing in, trying to find that vein. And you can see it. I mean, I'm sure you could palpate it. And it looks like this guy. So he should have gloves on. And he's telling him that he needs to move a little to his right to hit the vein. So you're going to, in just a second, you should see. There we go. So you see how the blood went up this catheter? That blood is filling into the flash chamber. So he knows he's somewhere close. He's either hit a vein or he's in the vein and he's got blood. He's got flash in the chamber. That's what it's called. It's flash, okay? So he's got that. And he's going to try to advance, but he's not able to. So now he's trying to tamponade. So, before it squirts out. His catheter probably ends much closer than where he's tamponading. So that is why he's not fully occluding that vein and blood is coming out. So we don't want that. You want to make sure that he didn't thread his catheter far enough. You want your hub of your catheter to be against the skin, right? So that is about an inch at least. That's not in the skin, in the vein, okay? So doesn't tamponade it, doesn't occlude it. It's just not what you want, right? This is not what you want to do. They haven't released the tourniquet yet. There we go. So that's definitely not what we want. Okay. And let's look at this one. So here we go. All right, so let's watch this one. So before I start, I really like that they have everything set out. So their tape, if you look in the bottom right-hand corner, is already torn. Their tegaderm isn't all the way open, but it's open enough that they're able to get it. Their tourniquet is out, their gauze, their alcohol prep. Their extension set is flush, so they know that there's no air in the line. They have a backup needle, or a backup IV catheter, another catheter open, but they haven't broken the seal on the actual needle, and they make their own sets. So that's how they do it. Every morning they make their own IV start kits. So that's an option. So he's talking about, that's how he makes it every morning. He goes through what everything is. Okay, so he's tying the tourniquet. Okay, he's got all of his supplies. You can look in the bottom left and see it. He's got all of his supplies in the corner, ready to go, within reach. He doesn't have to go all over the truck to get it, and he's palpating. So he's actually feeling for a vein. These aren't very obvious on this patient. And obvious, I mean, they don't stand out like the other ones did in those pictures. So he's found his vein. He's going to clean. He's going to go from an inward to an outward circular motion. He's not going to touch that site again. He's got his catheter. Now we didn't see him actually turn the hub, inspect the needle, all of that. But he does a beautiful job. He's got flash. If you notice, he got flash right here. You can see how the blood's flowing in there. He got flash. He is advanced his catheter. He's tamponading, okay? He's going to remove. He's going to attach his extension set. Okay, using sterile technique. He doesn't necessarily draw back, but that's okay because he flushes, he checks for infiltration, then he secures his line. Okay, simple as that. Okay, he secures it, then he tapes it down. He locks his extension set, and then he secures it with tape. Beautiful done. Excellent. Last but not least, I want to thank Jason Montecarlo and the Emergency Medicine Council for posting their videos to YouTube, so I was able to use them. If you have any questions, please let me know.